Hello, everyone. Thank you for attending today's webinar, Optimizing Revenue in Uncertain Times, presented by Well Health. I'm Michael Shoshua, and I'll be your moderator. The COVID-19 crisis took a serious financial toll on many industries, and healthcare is no exception. A study commissioned by the American Hospital Association predicts that in 2021, the healthcare industry can expect to lose anywhere between $53 to $122 billion, depending on the state of the economy. A portion of these financial losses is attributed to the COVID-19 pandemic, in which patients delayed routine exams, chronic condition checkups, cancer screenings, and other non-urgent medical procedures. As the healthcare industry navigates toward operational and financial recovery post-pandemic, technology and process automation will play a big part to drive efficiencies in the revenue recovery cycle. Our speakers today are Christine Supple and Meg Aronow. Christine Supple is the Director of Population Health and Ambulatory Medicine at Community Memorial Health System in Ventura, California. She has expertise in value-based program development, clinical analytics, driving population health initiatives, and direct patient care. She developed and provides leadership for the population health programs, where her clinical team provides care management, chronic care, and high-risk case management and behavioral health integration services. Her commitment to community-based healthcare has been exemplified throughout her career. Meg Aronow is the Senior Vice President, Platform Evangelist, and Client Success Officer at Well. Before joining Well, she served as CEO for Adaris Health and Senior Research Director with Advisory Board's Information Technology Strategy Council. Previously, she was Vice President and CIO of Boston Medical Center for more than a decade. Just a few technical notes before we begin. The webcast is being streamed through your computer, so there is no dial-in number. For the best audio quality, please make sure your volume is up. This webinar is being recorded and will be available on demand within 24 hours after the event. Time permitting, we will follow the presentations with a Q&A session. Please submit your questions using the Questions and Answers tab on the left side of your screen. Okay, now let's begin. Meg, please go ahead.
Hey everyone, thank you so much for joining. Let me set a little bit of context for how we're going to spend our next hour together, and so you know what to expect. Well Health has developed an industry perspective that will be available to you all as a playbook, which you'll hear more about at the end of the webinar. We've developed our perspective from our own research and also from talking with the hundreds of customers that use the Well technology. We've been informed by their perspective, by their struggles, and by their victories. I'm going to keep my comments, however, short today because we're lucky enough to be joined by someone who can tell you the real stories from the trenches, mostly victorious, sometimes a little bit frustrating, but I think that we're all going to be very well informed by Christine's perspective, so we're going to give her most of the airtime today. So let's jump in, and let's start with the fact that many of us, although not Christine or her organization, but many of us have seen that we've lost touch with some of our patients during the pandemic. Patients are slowly starting to come back. That's what we hear from our many customers. And yet we know that some have really been lost and need to be coaxed back, need to be reassured with education, need to understand what services are available, what has changed, and most importantly, where they can turn to get their many questions answered. With that, I'd like to hear from Christine about some of the many initiatives that you've taken and how you've succeeded in bringing those, really keeping those patients, as you've informed us, keeping those patients throughout these challenging times, and what lays ahead in terms of making sure that you have secured a welcoming environment for those patients.
Hi, Meg. Thank you so much for having me today and allowing me to share some of our experiences at Community Memorial Health System. We, too, like everyone else, was taken by surprise in this pandemic, and we really needed to pivot and figure out our next steps quite quickly. Last March, we decided that when patients couldn't come into our offices and access care, that we needed to leverage technologies quickly and efficiently. We were lucky enough to have WELL already established in many of our clinical workflows, but where we really saw WELL shine was that we were able to launch a complete telehealth program. We had 0 telehealth in March, and the first week in March, the last week in March, we had 300 telehealth visits. And then in April, we had 9,339 visits across our 15 outpatient clinics. And we really attribute a lot of that success to being able to communicate with our patients efficiently and effectively via well texting. Our patients not only were able to be connected with an e-registration link, they were able to also have the link to their telehealth appointments, as well as be able to have information given to them in real time. As you remember, Meg, at the beginning of the pandemic, things were literally changing on a daily basis. And some of the regulations that we needed to adhere to for patient safety and for public health safety were also changing daily or weekly. We were able actually to send that information to our patients via our well texting platform as well. So it was really an opportunity to leverage and scale and optimize workflows that we had worked hard to build as part of our foundation pre-pandemic, and we were really able to see the fruits of our labor and that we were able to scale these programs very effectively.
That's great, Christine. Thank you. You know, and I note too that you mentioned that you had the WELL platform up and running. We made a concerted effort to make sure that we could reach and help as many folks as we could during the during the onset of COVID, pre-vaccine actually. And we were very gratified that we were able to stand up the WELL platform very quickly for many new customers who found this as a very useful tool in terms of reaching out to patients in ways they hadn't previously envisioned. But there's no question you had a leg up by having this already in place. So kudos to you all for being so forward thinking. I think we can go on to the next slide now. And we want to talk about restoring patient confidence, which is a theme that we have heard from many of our customers. And for those of you who have heard me on past webinars, you know I have a particular interest in this idea of taking back your own messaging. So much of what we heard during the pandemic, we as a community and as a country, was coming from government agencies, from experts on the talk shows, from the print press, etc., all well-intended, mostly accurate, although, as we know, social media had some glitches with the accuracy of the information being disseminated. But messaging was coming from all over the place, when typically we would expect health and wellness messaging to be coming directly from patients' own providers and provider organizations. So really, if you haven't already, WELL believes now is the time for you to take back your own messaging. We actually heard earlier this year from organizations who said they were taken by surprise when major news outlets were saying, for more information, contact your provider organization. This was especially true during the vaccine rollout, and they were caught off guard. We work with our customers to make sure that you're always prepared. It can change on a dime, as Christine said, messaging, because our environment is changing every day. Our messaging is changing every day. And so we are pleased that we can be agile and that we can help our customers to deliver the right messages in the right moment, and that we can scale accordingly. So as we look to this new normal, whatever that means for your organization, please do think about using all of your messaging capabilities, WELL among them, to make sure that you are controlling your message and you are reaching out to the patients in ways that they need to hear from you, to restore that confidence so that they're returning to their routine maintenance, that they're anything that they may have put off or to maintain their health, they're coming back to your organization and they're feeling safe and confident in doing so. It feels like the right thing to do, from a care perspective, but of course it's also the right thing to do from a revenue perspective. And Christine, I know that you have many initiatives. We actually, as we prepared for this webinar, had a hard time just narrowing it down to those things that you felt would maybe have the most impact for your colleagues at other organizations in terms of how to get that messaging out and what messaging might be most effective.
Yeah, so as far as restoring patient confidence, you know, this was really an area, one of the areas that I'm most proud of. I think if you think about back in the pandemic, there was a time when there was a real bottleneck with patients getting COVID results, and there was a lot of angst around that. We were actually able, while we too had delays in our county with testing and getting the results back, we were actually really able to effectively leverage well in sort of bifurcating the process, and that we had half our patients, or the patients that had negative results, we were able to send those out via well and actually have a document in there that they could take to their employer and could really get back to work right away. And the patients that had positive results, we were able to, again, utilize well to let those patients know and connect them with our nurse or our physician immediately to talk about follow-up planning. So that was one thing that really streamlined that process for us and decreased angst and got patients back to work. And I think that they had quite a bit of confidence in our organization because we were able to be so proactive and efficient in a space that didn't feel proactive and efficient during that time. I think one of the other things that we were able to do was early on was make certain that we risk stratified our patient population around the COVID vaccine rollout. Those patients that were, whatever tier happened to open up, we were able to create campaigns and push that information out to patients and get them in for their vaccines. Again, early on, when vaccine was limited, this was a huge service to our patients. They really thought, wow, I'm at an organization that not only is identifying me as in this high-risk tier, but they're actually reaching out to me and they're telling me when I can come into the office, or actually initially we had our vaccine program at the hospital, that they're actually asking me to come in. And again, this is a real patient satisfier as well as a huge, it was a huge boon to these high-risk patients. They needed to be seen, and they needed to be seen immediately. And again, they were looking for somebody to help them along in this process, since demand was so high and supply was so low. As far as other things that we did to restore patient confidence, we also virtualized a lot of the our forms. So again, making it very easy for the patient to connect with our health system. We had a virtual after-hours clinic that we launched during the pandemic. Again, for patients that maybe didn't feel comfortable coming into the office, they had other virtual options, and we also were able to push that information as well as the forms via well. So there was sort of all sorts of things that we were able to do creatively and quickly utilizing the well platform.
Christine, we didn't rehearse this. I'm going to put you on the spot for a minute. I know from prior conversations that you talked a little bit about something that I hadn't heard from our customers, about being able to print out a verification, a vaccine verification. Can you talk a little bit about that?
Yeah, so we did try to figure out how to attach a document onto the well, and there is a way of doing it. But what we did is we did something a little bit different. We were able to personalize the well text to the patient. So we were able to say Joe Smith, had his COVID vaccine and it was negative, something to that effect. But we were able to personalize it as well as put our contact information on there. And many patients, not all patients, but many patients were able to take that to their employer as proof that they had a negative COVID vaccine. So again, in those early days when everything was bottlenecked and patients needed the information so that they could go back to work, it was really effective. Now, again, there is a mechanism to attach a document to a well text, but that was a little clunky. And again, so because we send secure messaging, there was multiple steps that the patient would have to do in order to make that document actionable. So we decided to just simplify it. And again, for the 75% of patients that it sufficed in the workplace, that was great. It took that off of our lap, and it gave the patient immediate information that whereby they could get back to work.
That's great. We are learning every day from our customers, you and others, and so we love to hear about the creative uses of the platform. That we intentionally designed it in ways that would be agile and easily configured by our customers to meet whatever needs were presented by the marketplace and also by their own internal processes. So what you just described is something I hadn't heard before, and hopefully there'll be folks on the call that can think about that and use that to their advantage as well. As I said, always learning. So thank you for that.
Sure.
We can go on to the next slide. And you touched on this a little already because you talked about vaccine risk stratification, but we know that many patients who might have deferred elective procedures or unfortunately even deferred routine care for chronic conditions, because of COVID, because of their own fears, or just because of really being smart, frankly, and keeping themselves safe and in safe environments, that we want to bring them back. Many of our customers have actually reduced their staff during COVID, although those numbers are starting to restore themselves. So they want to be sure that from a capacity management point of view, they're looking across their patient book of business and taking those at the highest risk first, making sure that there's capacity to handle those patients, as well as safe spaces and safe procedures to handle them. And so, we've been encouraged by talking with our customer base to understand the way in which they're using their EHR systems, their BI and data warehouse systems to understand how to risk stratify those patients, and then use the WELL platform or other means of communication to encourage those patients, number one, but then number two, schedule them in a way that matches their capacity and sort of maximizes the value of the care that they're able to give as they begin to staff back up. At this point, I think most of our customers have reached what I'll say is fully staffed and fully open for business, although it may still be somewhat diminished from its pre-pandemic days. But I think they're pretty much at the point where they feel they're fully at scale. Nonetheless, with all the pent-up demand, there seems to be a good reason to have to create the right kind of cadence and filtering for bringing patients back in. And so we've been interested to watch and to have been a part of that kind of communication with patients. And Christine, maybe you have some stories you can share around that.
Yeah, well, thank you, Meg. Being in population health, one of the things I spend a lot of time thinking about and doing is risk stratification. How do we take limited resources and make certain that our highest need patients are being taken care of and being connected with services? And I think, never was it more apparent than during our pandemic. We really needed to figure out who were the patients that were going to need us most during this time when we had a somewhat limited capacity. Although I would argue that we didn't have limited capacity, I would argue that we did quite well during the pandemic, and our volume metrics actually shows that we stayed about 90% of our current volume, even during the height of the pandemic. We had a couple of months that were a little rough, but we did quite well in that respect. But getting back to your question, risk stratification, we looked at multiple different high needs populations, but two that come to mind are OB patients. So we had some OB patients that were a little reticent to come into the office. So we created a program that was emulated after the Mayo Clinic's OB Nest program, which is a remote patient monitoring program for our OB patients, where they would opt in to choosing to be monitored at home. They would get a Doppler ultrasound kit that they could utilize for about 4 of their visits, 4 of their total visits during the 9-month duration. They would be able to do a telehealth visit with their obstetrician and be able to utilize the fetal monitor during that telehealth visit. There was a whole training portion of the program, as well as bidirectional communication, utilizing well so that these patients could communicate with the nurse, the doctor, or the MA at the clinic. So again, it offered these patients who are reticent to coming in another option, as well as allowed us to be sort of creative and innovative in our marketplace. We also partnered with Gold Coast, who is our local purveyor of Medi-Cal, and they gave us some grant money so that we could offer our most vulnerable patients this Doppler ultrasound free of charge. So again, it gave us this opportunity to be creative in the marketplace. It gave us an opportunity to bridge a gap for patients that felt uncomfortable, as well as leverage technology so that they felt that they had a means to communicate with our providers, again, bidirectionally and in real time. So that was one of the things I was most proud of during the pandemic. There's one other population that we really made certain didn't miss out on their wellness care, and that was our diabetic population. We kind of doubled down on our patients that had hemoglobin A1Cs greater than 9. We had about 250 of them that we look at pretty closely in general, but we, again, doubled down on this, and that we utilized well to reach out to these patients, make certain that they were connected with telehealth appointments, either with their endocrinologist or their primary care providers. We also transitioned our nutritionists over to telehealth so that this high-risk population would have access to our nutritionists, as well as our certified diabetic educator, who is also an RN that runs our principal care management program around diabetes. So again, they were able to send out campaigns, keep the patients in contact with these various programs to make certain that we were able to wrap these services around these high need and high risk patients. So those are 2 examples of ways that we were able to utilize well with our patients that had the greatest need.
That's great, Christine. You know, we'll be talking with you and with other customers that we have in the coming months to see how much of what was developed really in response to these extraordinary times will stick, right? What are the lessons that we've learned in terms of reaching out and engaging with patients that will work for us even in this soon-to-be post-pandemic era, whatever that new normal is. We're understanding that quite a bit of what was learned during these last few months will be part of the go-forward strategies for many of our customers. So it's for all the negative that we've had, it's been a great learning experience, I think, for everyone. Just a reminder, put your questions into us. We've orchestrated this so that we'll have plenty of time at the end of the session to take your questions. I see we already have one question that's going to be about telehealth, which is one of the things Christine was just discussing. We'll keep on with our agenda, but we will be sure to circle back and get that question at the end. So if there are other questions, please feel free. That's why we're here. We love to engage in that question and answer part best of all, actually. I think we can go on to the next slide now. Back to business. Many folks actually started months ago to plan what back to business would mean. As I said, in some cases, it's keeping items from lessons that we learned during the pandemic. In other cases, it's reverting back to pre-pandemic processes. Those folks that were forward-thinking were really starting to think about this even in the fall. Some folks are only just coming to it now, but either way, it's definitely time now to start thinking about what does back to business mean, what does the new normal look like for your organization, and what kind of feedback have you gotten from your patients as you were engaging with them in different ways? How much will remain virtual We had a lot of customers, for instance, who adopted virtual waiting rooms, and patients seem to really like that. They don't miss the waiting room experience at all, at least from what we've heard. So certain things we think are around for good. We also saw a big uptick in our customers working not directly with us, but we were involved in the process, but with our partners around collecting mobile payments. That was just part of the no-touch safety experience. So we think that too is probably here to stay. Christine, I know that your organization didn't do the mobile payments specifically, but you did find other ways of maintaining your business that seem to be things that you may keep up with, even as we move back into a safer environment where people can come in. Can you talk a little bit about that for us?
Yeah, that was a little bit harder for us. As far as collecting the copays, we had to do a lot of back-end work on that. We didn't have systems set up where we could collect our copays in a non-touch, way. But I think, again, that was a lesson learned for us, and it's been on our roadmap to optimize that part of collecting our copays. But we're looking at that as definitely a goal for this year. As far as getting back to business, there's, I think you mentioned this before, there's a lot of pent-up demand. Patients who haven't been seen in a while, haven't had things such as colonoscopies, pediatric vaccines. We have a 1-year backlog almost for colonoscopies. And really getting those patients in, getting them into for routine screening has been really one of the things that's been on the forefront of our minds as we've moved into 2021. We've utilized well to remind patients to make certain they bring up their or pick up their colonoscopy pack at the pharmacy. We've made certain that we can message to them that they need to fast X amount of time before their procedures. We've actually done some pediatric vaccine campaigns. We actually had a drive-through pediatric vaccine program during the pandemic. So we were able to message via well that we had certain times available where patients where parents could bring in their children and kind of come through our parking lot and get pediatric vaccines. But again, now we're utilizing well to remind those patients who may have deferred vaccines during this past year to make certain that they're getting in. We were really lucky to work with really proactive pediatricians who made certain that our pediatric population didn't fall behind and, put in extra hours and night hours to make certain that we were meeting the needs of the community in that way. But again, there were people who didn't want to seek out routine care during the pandemic, and now we're really making certain that we are identifying those high-risk populations and bringing them in now. I think delayed surgeries is another area that we're just sort of getting caught up on now. We're making certain that we're utilizing well to message to these patients, where to go, what to do. There was some pre-COVID, pre-procedure COVID testing, and again, there was sort of a lot of pieces to that. We made certain that we were able to message them via well for their pre-procedure COVID testing. So there was a lot of different areas we were able to utilize well in order to get back to business.
I love hearing those stories, and I love the idea of these drive-up or drive-through pediatric vaccines. It's so indicative of how norms and expectations have changed so quickly in the past 12 to 18 months. I'm just imagining back when I was working in academic medical centers here in Boston, if I had pitched that idea to my colleagues 10 years ago, what kind of reaction I would have gotten to drive-through vaccine clinics. But it's such a wonderful and innovative way to make sure that you're reaching the community. As you say, in these days, it's all about population health now. And again, unscripted, Christine, but I think one of the things that you talked about when we were just generally talking about population health was the idea of how how to use smartphones, or how prevalent smartphones are in terms of reaching various sectors of the community. Do you have any, I know that your population health is one of your passions. Do you have any comments about that?
So, you know, I'm sure most of the people on the call can relate. We think everybody has smartphones until nobody, and even if they do have a smartphone, they may not know how to use it. And so we did sort of run up with to some barriers there. We found instances of you know, a couple of our homeless patients that actually had smartphones, and one of our primary care doctors doing telehealth via smartphone with one of our homeless patients. You know, we had patients that had smartphones but maybe didn't know how to use them, and we were not successful in executing the visit. We have patients that don't have access to smartphones, but again, we worked with one of our local community partners who helped patients. They had a digital bridge program, which was specifically targeted to patients that didn't understand how to utilize their smartphones. So we connected patients with this digital bridge program, and it was, again, quite helpful in getting patients connected and understanding this new norm, this new technology norm. But what we found with technology is probably the best asset was a daughter or son who knew how to utilize the technology. And that's really, I think, where we sort of went with this. We also, I have to really commend our support staff. You know, our medical assistant staff spent a lot of time in problem solving with the patient and the patient's family and setting up a successful visit. You know, there's I can't overemphasize how much the workflow changed for our medical assistant staff. And again, we are a 15 clinic system. Actually, there's 26 clinics in our enterprise system, and each of those support people really queued up that visit for our providers in a way that they've never had to do it before. So I think the whole question around you know, smartphones and smartphone technology is that it's really multifactorial, multifaceted, and getting somebody in your health system who can connect that patient to the you know, to the process is really important. I think another thing that we learned is we had to set up a telehealth platform, again, like from one day to the next. So we needed to leverage, as an organization, we had to leverage technology that we already had in place. And I think as we move forward, we would like to think about, you know, evolving a platform that's very patient-centric. Some are more patient-centric than others. And again, so we're working hard as an organization to make certain that we partner with companies that really put the patient in the center of this process.
That's awesome. Thank you for sharing that. I appreciate that. We are mindful at Well that this technology, which is so important right now, has been so useful, has really kind of saved us in many ways. We are committed to the idea that should not be sort of the new frontier of the digital divide, right? This should not be another way in which we further divide the populations with whom we're trying to serve, with the haves and have-nots. So this kind of continued education, making things simple and intuitive, serving things up in intuitive ways. In our case, that's through SMS, something that's familiar to many people. It just feels so important. So we try to keep our eye on that. And it's, your stories are great to hear, both the successes and the learnings that you've had. I think that's going to help the industry overall. I think we can go on to the next slide, please. Streamlining operations. So one thing we haven't talked a lot about, and I'm just going to touch on it, we don't need to dwell on it, but you can read more about it in our playbook, is the use of these kinds of technologies to drive staff efficiencies. In our case, I'll speak to Well because I know it so well, but there are other technologies as well that would be relevant. But in our case, the idea of having call center folks using text rather than voice calls, so that they're managing communications on a one-to-many, one staffer to many communications simultaneously, has really proven to be a huge boon to staff efficiency in those call centers, and also a delighter, a patient satisfier as well. So I think that the technology has, we don't talk about it as often because we're so focused on what kinds of healthcare improvements we've made in terms of quality of care and delivery of care, but there's a revenue side of this, right, or a cost side of this as well, that these technologies also deliver great staff efficiencies when implemented properly. And one of the new things that we've done at Well, and that I'm going to ask Christine to talk a little bit about, because as part of our early adopters program, we've been working with her organization closely. Community Memorial Health System was part of a program that we have where we sort of pressure test the new features that we're rolling out, and one of those is call to text, meaning the ability for a call center to move seamlessly from a voice conversation into a texting conversation. So Christine, maybe you can talk a little bit about that, and if there are other things that you want to talk about regarding streamlining the operations, let's hear about those too.
Sure. So we were part of the pilot, the call to text pilot, and we actually just started implementing it. It seems to definitely be a patient satisfier. What we find a lot of times is, especially during our peak volume times, patients will hang up and then call right back, again, further exacerbating that volume call cycle. And so now we've put something in there with this call to text feature, whereby the patient is able to sort of immediately connect with somebody. And again, many times we are able to satisfy that request or that conversation in a text format. It also allows the patient to leave a number and call, and we can call them at a later time. So both things have been, at least at initial glance, a patient satisfier. We're hoping actually to expand our call to text pilot. What we have found is it does require, resources on the other side, somebody there to man these, and so we're trying to look at, staffing models around that text demand, because again, if you have a call to text feature, that patient wants to be texted back, pretty much in real time as well. So we've been working through some of those, but initially I think that this has definitely been a positive for our call center staff as well as our patients. As far as streamlining operations, one of the things that we've really struggled with to some degree is the number of referrals that we're having to process. We've just had a huge demand for referrals now that patients are coming back into the office. And we've been utilizing Well to, again, manage our patients' expectations around the referral timelines. So, once we've submitted the referral, we're able to send the patient a text saying your referral was submitted on X day and is usually turned around within 7 days. So again, hopefully keeping that patient from calling us, and because they have the information in hand. A lot of times, if a patient doesn't get that type of information, they're calling to say, did you submit my referral? When am I going to get my, referral? And again, that creates a lot of call volume. So by intercepting that process and giving the patient the information, we've been able to, I think, streamline our referral notification process much better. Once the referral actually has come through, then again, we're able to text the information to the patient. You are scheduled with Dr. Smith, please call the office, or your referral has been approved for Dr. Smith, please call the office at this number. And again, making that an automated process and not necessarily utilizing staff to make those types of calls. So it's been very helpful.
Great, thank you. I'm interested to hear you say, talking about patient expectations when we're texting, right? That's one of the things that we speak to often is, and something that people don't necessarily think of when they're first implementing texting solutions is we definitely have, we as patients now, I'm saying, have a different expectation in terms of the timeliness of a response. I mean, just think about your own expectations when you're trying to text with a family member or a friend and they don't get back to you for a long time, right? Or they sort of disappear in the middle of a texting thread and you're sort of left hanging. Those are the same kinds of expectations that our patients have when we switch to text. So even as I say, it drives staff efficiencies, it does create different expectations that we need to manage our workflows to meet those expectations. It's a bit different than anything we've done before. So there's learning that's happening on both sides, but definitely there's an impatience factor, I guess I would say, that happens that we need to manage. So thanks for sharing your stories on that. We're really looking forward to further rolling out this feature to other customers. I think it's going to be a really big win to folks, as it has been to you. So we're excited about that. Okay, next slide, please. And I think this is our last slide before we go into Q&A. So again, just another reminder, please feel free to submit any questions you have, whether they are specific to Well, I see a couple of those in there, or whether they're more general around the technology or around Christine's experiences. So behavioral health, this is our last slide. This is a tricky one. We know that behavioral health has, for over a decade, I would say, led the way in terms of volume of telehealth visits that are conducted. I remember working with one of the Boston area hospitals on this really more than a decade ago when they were new, this idea of telehealth. So on one hand, we thought we know it's well entrenched. On the other hand, when it comes to texting, they've been interesting conversations that we've had with our customers. There is a certain amount of ill ease around how much texting one wants to do, even in secure messaging, just because of the privacy concerns around the behavioral health visits. So it's been interesting, and what I will say from our experience with our customers is it's really all over the map in terms of the comfort level. The technology is there. The technology is not in question in any way, but based on risk, based on compliance, based on advice from the relevant departments within the provider organizations, our customers have developed very, very varied approaches to this. So we think it adds value, but it would be hard for me to say at this point that we're seeing normative behavior in how texting is used for behavioral health. But Christine, you guys have found a path through, so maybe you can share that as one learning point for all of us.
Yeah, so we have launched 2 different behavioral health integration programs. One is for our fee-for-service Medicare patients, and another one, we secured a grant from DHCS to do behavioral health integration for our Medi-Cal patient population. And we take a very conservative approach to any type of texting within the context of behavioral health. We do utilize secure messaging. It's typically within the context of a telephone visit. So we do have some virtual visits that we do via telehealth, and that's on our inpatient side. We hopefully will be able to expand utilizing the well functionality, as we mature in this process. So currently we are utilizing the texting feature only if we are on the phone with the patient. So, but more to come. I think as we develop our processes and as we develop our comfort level. And again, there is some patient expectation around communication. If we're communicating in this way for other groups, patients actually, it sort of normalizes texting. But again, the type of information that can be shared over text, we take a very conservative approach to.
Great, thank you for that. It looks to me like we are right on time in terms of where we wanted to conclude to ensure that we're leaving enough time for a Q&A session. So Michael, I'm going to turn this back over to you, and we'll see what we've got in the question section.
Thank you. It's interesting to note that all the workflows as well as recommending for revenue recovery were also being used by community health to keep the business going during the pandemic, and also you could say the same for the operations overall. So let's indeed now move on to the Q&A. There is still time to submit your questions using the Q&A tab on the left side of your screen. We've got lots of great questions already, and we will try to get to as many as we can. The first one here is, how has the pandemic affected your remote patient monitoring programs?
Yeah, so our remote patient monitoring is really in its infancy. We've been doing some pilots in remote patient monitoring, like I had mentioned, around our OB patients. We also are looking at doing some remote patient monitoring for patients that have CHF. But what the pandemic has allowed us to do is actually has allowed us to help the patient understand how to transmit data in a way that they really hadn't understood before, or how to connect with the doctor's office virtually. Again, that felt fairly foreign pre-pandemic, and now that connection has been accelerated given the pandemic, because patients now have more of an ease in a virtual platform and connecting the information to their doctor's office virtually. We actually utilize a patient portal, so that patients are able to download information via the patient portal, and we hope to be able to utilize some of that information in remote patient monitoring moving forward.
All right.
And I'll just jump in and share a little bit about what we've heard from some of our other customers. So from our platform specifically, we know that folks are using the well texting capability or IVR capability for sending out educational links or just reminders about daily activities. So it's not remote monitoring that we do specifically, yet we sort of surround that remote monitoring capabilities with efficient reminders and education. We've talked with customers around using that element of the WELL platform around obesity programs, around falls assessments. We've even had some conversations around hospital at home, a term that will be familiar to many of you. That's much more intense, but again, with WELL really sort of finding the sweet spot and our lane around reminders and education. And in that regard, it fits with many different remote patient monitoring programs and initiatives.
All right. Christine, with COVID appointments and regular care also, has Community Memorial Health System reached its peak demand? Would CMHS have to start working to generate demand?
Oh no, we haven't reached our peak demand. I mean, we've reached a peak in demand, but we have plenty of capacity to build more. And as far as generating demand, we are not. We are generating demand insofar as making certain that our high-risk populations are getting in for their needed screenings and well care. But at this point, this whole next year will really be about making certain that patients that have delayed care are getting in and connecting the dots on well care.
I kind of have a follow-up here. Are there any tactical changes that you're thinking about that would address the challenges in demand?
Yeah, and I think I spoke to some of that earlier on, that we are utilizing WELL to make certain that, for instance, the volume of colonoscopies, where that was really that process was stymied, and so we're making certain that we are leveraging WELL to get that information out to patients, to be proactive in our outreach to those patients. So patients that historically we might not have been as proactive. Typically the doctor orders the test, then the patient schedules the test, and then the patient comes in for the test. Now we are really proactively looking at those lists of patients that have delayed care and utilizing well to make certain that we get them to come in. We've also, like I mentioned before, have a virtual after-hours clinic. So patients that either can't be accommodated with their primary care doctor, or patients that, again, may still not feel comfortable coming in, they have other avenues for care now. And we've been, again, proactive in making certain that our patients understand the array of services that are available to them.
Great. The next question we have here, what are the biggest challenges that practices face regarding retaining patients in the new world of telehealth? If either of you want to jump in.
So I can take that. So again, telehealth, there was a learning curve for telehealth, at least for our health system. I know some people had gotten into the telehealth game early on, but because of the payment parity rules from CMS, all of a sudden we were able to see patients via telehealth the same as an office visit. And I think that the way that we approached telehealth was we started to message to patients on our website. We actually put messaging out at each of our offices with a number that patients could call to be connected with telehealth. And then we worked very hard in training our providers in something called webside manner. We really, we understood that this was new. This was new to our providers. Where do you look in the camera even? How do you connect with a patient in this new platform? So we worked very hard, not only on the messaging side to our patients, also on the technology side to make it patient-centric, also in our staffing to make certain that they understood that this was new to the patients and that we were going to have to do a lot of hand-holding through it. And then with our providers, to once we got all of those pieces in place and the patient was in front of them, how do you then connect virtually with a patient? And one of the things that I'm most proud of is that I think we were able to make meaningful connection. Telehealth isn't a panacea for all care. It is a bridge during the pandemic, and I think ongoing, that there is going to be definite utility. Things that I hear from the patients are, wow, it's so nice that I'm able to have my visit during my lunch hour, or that I'm able to take my break and execute a visit. And again, that's something that I think will be here to stay. I think that for following up labs and for some urgent care type of routine care visits, I think it's definitely here to stay. But I think that we still have some things to learn, not only as a health system, but also in our in our environment. I don't necessarily think that the pop-up telehealth type platforms are good for our health system. I think that telehealth platforms that are integrated with your primary care provider, so that you can have that you can have a consistent care over time, I think is a better method.
And I'll just jump in to say, to talk to that point about retaining patients. I would say look to the patient surveys you've had that have nothing to do with telehealth, because the issues for patients and patient satisfaction are really the same regardless of the medium, whether those are in-person visits or telehealth visits, right? Patients want easy access. They want hours that suit their lives, not the providers' lives. They want providers to be informed about their conditions and not to ask repetitive questions, that they've already answered. so it's really all the same. We've got to sort of change our mental model a little and say, does my telehealth platform address those issues equally as well or better than my physical on-site presence visits? But the issues, the things that satisfy patients are the same. So of course, the one that we most focus on is access, right? So the technology needs to be bulletproof and easy. That's really the biggest change. But I would look deeper than just access at some of those other satisfiers as well.
Thank you. Meg, a listener would like to know how they could get additional training for campaign outreach.
Great. Well, this is definitely a specific question for us. Please just reach out to support once we've heard from you through whatever your traditional mechanisms are, usually email to reach our support team. We'll make sure that you hear either from your account manager directly or from a member of the support team, either with documentation or just with a Zoom call to help you through to make sure that you're achieving whatever it is you're setting out to do. Easy peasy, no problem.
All right, great, thank you for that. Our next question here, with health literacy and access to care being a challenge in underserved areas, how should providers make sure they're reaching these key patient populations?
So, we do struggle with that here, but I have found one of the most effective ways of reaching your underserved populations is leveraging your community partners. We have regular meetings with a variety of people in our community to make certain that we understand the resources available, but not just in a list format, in a warm handoff format. Again, one of the things that we've really worked on for the last couple of years is making certain that we know individuals at these organizations and that we can warmly hand these patients off. I've really worked hard at making certain our providers, if they have a patient that has a need, they can just, I've simplified it. They can refer the patient to care management. Just put in a referral to care management and say what the patient need is. And then I have a team of people now that are working behind the scenes to make certain that patient is connected with a resource that can really connect the dot for the patient. The other thing is we're working locally on a community information exchange. So again, we have a consortium of partners that are working to make certain that we as a community have a fabric of people that are able to help these underserved individuals. But I would also say that during the pandemic, and it gets back to something that Meg was saying about people not having access maybe to smartphones or something like that. The pandemic really equalized a lot of people. There were people who had a lot of money who didn't know how to utilize their smartphones because they had other things that were inhibiting them, maybe age, maybe health literacy in the digital format. So what I have found is that while the traditional underserved communities are definitely an area that we need to focus on, that there were a lot of people that struggled during the pandemic, and that we really need to look at each person as an individual and understand what their individual barrier is. Because there are people who maybe have age as a barrier. Maybe they're unable to drive. Maybe they're unable to have food, again, during the pandemic. Maybe somebody has enough money but doesn't have a way, or maybe they were too afraid to go to the supermarket. So I think what it did was it turned my thought process around underserved or need in a totally different light. Look at the individual in front of you and risk assess based on a whole constellation of variables rather than just the necessarily the historical socioeconomic underserved needs. So that's what I would say.
Great, thank you. Our next question here, beyond technology, what do providers need to put in place to respond quickly to the next crisis, whether it's people, process, or something else?
Yeah, I think this is one of the best things that came out of the pandemic. We had another sort of mini crisis in our community, and I tell you, we were able to rally people and get them together and really really operationalize a plan extremely quickly, because we've worked this past year with one another virtually. It was just a matter of sending out an invite and really getting everybody in a virtual meeting and executing a plan. I think we, as a community and as a health system, have really shored up our communication and across many different lines. And historically, there were more silos. And I would say after the pandemic, we are really sharing communication in a much more efficient way, in a much more effective way with one another. And it's all the way, from the C-suite, across our whole health system. And that's been something that I think will make it so that we can position ourselves efficiently and effectively for anything that sort of comes up in the future.
Great, thank you. We've reached now the end of our hour, and we have a lot of great questions today. We couldn't get to all of them, but we'll try our best to get back to everyone who submitted personally after the webinar. So thank you for attending this Fierce Healthcare webinar and submitting so many great questions. I'd like to thank our speakers for participating and Well Health for presenting today's webinar. This webinar has been recorded. You'll be able to access the recording within 24 hours using the same audience link sent to you earlier. Thank you again for joining us, and we look forward to seeing you at future events.